Hi, my name is Dorothy and I work at San Joaquin Valley Rehabilitation Hospital, and I'm an occupational therapist here, and I'm going to be presenting just a brief overview of spinal cord injury and some of the things that come along with having a spinal cord injury. Um, as a brief overview, the spinal cord actually is part of the central nervous system, which includes the brain and the spinal cord as the main communication centers for the body. Starting with the brain, it sends messages down through the spinal cord, and from the spinal cord up to the brain where things can be interpreted. There's two components that we look at for that. From the brain going down is the motor component. I want to feed myself. My brain tells my arm what to do, grab the fork, bend my elbow. It lets my wrist know what to do. It tells my body what to do. Then there's the sensory component where the body is telling information back up to the brain. So if a fly lands on your arm, you know just to kind of do a little flick or just move it. You can know it's a very light touch, not something dangerous. If a spark flies off of a campfire and touches your arm, you know that it's going to hurt, but your body doesn't know that. Your brain is what tells it. So the spark hits you, the message goes up to the brain says, that is dangerous, move out of the way or do something more drastic. So the brain talks to the body and the body talks back up to the brain. And there are different types of spinal cord injuries. It may be a trauma from an injury, a fall, a shooting, a stabbing, a car accident. It could be from a tumor that's blocking the messages that get from the brain to the body or the body to the brain. It could be infection that causes just a damage to that spinal cord area. Now, if you think about it, people know about paralysis that happens in the arms. If the message cannot get from the brain, it goes down through and it sends messages out to my arms, to my legs. The higher the injury is, the less messages go down through the body and you're more paralyzed. The arms, everything will be paralyzed. The further down the injury is on the spinal cord, the more messages can get through. Maybe you can move your arms, but you can't move your legs. But we don't think about the other things spinal cord injury can affect. It affects how you go to the bathroom. It affects the muscles that affect your breathing. It can also affect your regulation of your heat and your body system, so people don't sweat the same way. Lots of things that you don't think about besides the paralysis itself. But if you think about it, most of the time people think it's the limb that's injured, but it's really not. It's like having a telephone cord. If you have a telephone and you cut the cord, there's nothing wrong with the phone. If you put a new cord, the phone will work. But you can't put a new spinal cord into a person. Science is coming along. They're doing the best they can to see how they can help that to become better. And injuries are a little bit less traumatic than they used to be because of the good education that's being given to the community on first responder and all of the medical advances. So there's hope out there for people with spinal cord injury. But we do treat patients with all different types of symptoms here at San Joaquin Valley Rehab Hospital.